Sirano from 3BS and 9, and for today I will do the return demonstration on how to irrigating a colostomy and on how to change a stoma bag. The materials I use for irrigating the stoma, I have the irrigating solution, irrigation bag with tubing and cone, I have new appliance, lubrication, alcohol, gloves, tissue or wipes and soap. I have the commode or bedpan, and I have the irrigating sleeve. Good morning, ma'am. My name is Mary O. Sirano, and I will be your student nurse for today. May I know your name, ma'am? And your date of birth? Okay, so for today, ma'am, I am going to irrigate your colostomy by instilling lukewarm water into your bowel to stimulate your colon to contract and to expel or eliminate the feces out of your colon. So it's okay for you, ma'am? So, ma'am, I will assist you now into a comfortable position. So, are you comfortable now, ma'am? Okay. And I will now expose your stoma, ma'am. And I will perform hand hygiene. And I will put on gloves. I fill the irrigation bag with 500 to 1000 ml of lukewarm water and I will hang it. I will apply the irrigating sleeve into the stoma. And I will place the end of the irrigating sleeve into the commode or bedpan. Irrigating catheter has a cone attachment to prevent injury to stomal tissue. And now I will prime the tubing. I will make sure to remove all the air to prevent the air entering to the patient's stomach because it can cause major or some major discomfort. I will make sure that all air are out. After that, I will lubricate the cone. Lubricate the cone to avoid friction and insert the cone or catheter into the stoma not more than 8 cm or 3 inches. If the catheter doesn't advance easily, allow water to flow slowly while advancing the catheter. Never force the catheter. Allow the tepid flow to enter the colon slowly, and if cramping occurs, I will stop the tubing and water should flow on over 5 to 10 minutes. So ma'am, if you feel any cramping or discomfort, just let me know. If the water already instilled to the patient's colon, I will wait for 10 seconds and then gently remove the cone or catheter. Now 10 to 15 minutes for most of the return of the stomach contents, and I will dry the sleeve sheet and clamp the bottom of the sleeve and attach it to the top and allow the patient to ambulate for about 30 to 45 minutes. Ambulation promotes peristalsis and completion of the irrigation return. After the patient complete the ambulation for about 30 to 45 minutes, I will remove all the feces and I will now remove the irrigation sleeve and I will discard it properly. Now I will cleanse the area with water and soap. Remove all the remaining pieces and I will dry it gently but thoroughly. I will replace the colostomy dressing or appliance depending on the patient's need, and I will cleanse all the materials I use and I will discard it properly. I will remove gloves and discard it properly, and I perform hand hygiene. So ma'am, we already done in irrigating your stoma. How are you feeling right now, ma'am? Okay, thank you. Now I will document all the procedure I've done to my patient for accurate data. Now introduce myself to my patient, explain the procedure, and identify my client. So, good morning, ma'am. My name is Mary Joy O. Serrano, and I will be your nurse for today. May I know your name, ma'am? Okay, and your date of birth? Okay, ma'am. So, for today, I am going to change your stoma bag. The purpose of changing your stoma bag is to clean the stoma, to prevent infection, and to check the color or appearance of your stoma. Is it okay to you, ma'am? Okay, so I'll be right back, ma'am, for the materials. Materials I use to change a stoma bag, I have here the measuring device or template, new appliance, washcloths, water, soap, apron and gloves, and I have scissor, marker, and bedpan, and jug for the contents of the appliance, and disposable bag for use appliances, tissues, and wipes. I will perform hand hygiene. And I will now place my patient into a comfortable position. So ma'am, I will assist you now into a comfortable position. Perform hand hygiene. Put on gloves. Place a pad to protect the patient's clothing from the effluent or from the leakage of the appliance contents. Ma'am, I will place a pad so as not to soil your clothing. The bag is of the drainage type. I will drain all the contents of the appliance into a jug. So ma'am, I will now open the appliance and drain all the fecal contents into a jug. And after all the contents of the appliance are removed, I will now remove the appliance. And I will discard it properly. So there you go, ma'am. The bag has been removed. I will now cleanse the stoma to remove the remaining pieces and discard it properly. Now I will assess the stoma for any soreness, ulceration, color. If the skin is unblemished and the color is healthy red, then I will proceed. Because if the site of the stoma is color black, it indicates that the site are not receiving enough oxygen, and I have to report it immediately to the doctor. I will now wash the stoma with water and soap to promote cleanliness and prevent skin excoriation. And now I will dry the stoma gently but thoroughly so that the new appliance attach more securely. So ma'am, I am now drying your stoma. If you feel any soreness, just let me know. With the measuring device or measuring template, I will measure the stoma for the appropriate size. I will mark it. And I will cut the appliance a little larger than the stoma so that the effluent cannot cause skin damage. After cutting the appliance, I will now apply it into the stoma. And secure it properly. So, ma'am, we are done. How are you feeling right now? Okay, ma'am, great that you are good. And after that, I will discard all the materials I use, especially the soiled linens and the tissues, and I will discard it properly into a trash bin. And I will remove my gloves. And I will perform hand hygiene or hand washing to prevent infection. And after that, I will document all the data or the procedures I've done to my patient.